Hello.
Hey, Cameron.
Hello. Hey, how you doing, my friend?
All right. How are you?
I'm good. I'm good. How's the show going for you?
You know, it's been a lot of fun.
Okay, good.
Yes.
You gonna keep it going?
Yeah.
Cool. Because I have an offer for you.
Oh, you do? What do you got?
Well, yeah, I think you're paid up for till the end of April, I believe.
Has it been a whole year?
Almost. Let me just double check before I open my mouth and put my foot in my mouth again, you know?
Yeah.
Because let me just check. Let me pull it up for the first show here. Hang on. It might not be. But
Yeah.
it
No,
feels
I
like
don't think so. Because
it feels like you started in August, I think, actually.
yeah, this is number 30 or 29.
Yeah. Let me just check. I'm pretty sure you're right. I'm probably way off base. Okay, what the hell? There we go.
Well, maybe I'm getting at like 7 months.
Yeah. So let me see. First
I think
show.
August,
Oh,
September.
July. You started July 2nd.
Oh,
July,
okay.
August, September, October, November, December, January. So we're into our 8th month, which means we'll go to March, April, May, June, end of June. So if you can sign on today for 6 months, for 6 more months to the end of 2020, I will cut the price of the live show in half for you.
Oh, so what is that?
That would be 1350.
1350.
Yeah, it's half price because you're paying 450 per month, and I'm giving it to you for 225.
Wow.
Yeah.
You know what? I got to look at my finances. Everything's pretty tight right now with the beginning of the
Right.
year. So,
Right.
yeah.
But if you can do that today, I'm happy to honor that at 1350. I'm trying to raise a few funds here.
I
We
hear
had
you.
some unexpected expenses as they happen, not with the business, with family stuff that I got to
Yeah.
take care of,
Got
and
it.
I gotta. It's just one of those things.
Got it.
And I can't tap into the business for it because the business needs it too.
Yeah.
So I got to try and make deals.
I hear you.
But yeah, that's a good price, half price.
Yeah. Well, yeah, you're just catching me in a cash flow shortage right now. So
Mm.
I'll have to look at it.
Yeah, if you can, and let me know if you can put anything. I mean, if you can put even more than half towards it, I'm happy to do that, and then we can do the other half at the end of this month. It's fine.
Okay.
Yeah,
Well, let me look
if
at
you
it.
can do like $800 today, and then the balance of that at the end of February, I'm good to go
Well,
with that.
I have payroll this Friday, Cameron.
Oh,
So
okay,
that's
all right,
I gotta
that's
look
your
at it. Hey,
yeah.
I gotta get a quick glass of water. I have a guest coming on, Mary
Okay,
Clifton.
okay,
So
good,
hang
good.
tight.
Yep.
Hey there, Mary. Uh-oh, can't hear you.
Hello.
Hello?
There she is.
There we go.
Great.
And that's my favorite audio too. So it's good. It's good stuff.
Good deal.
How are you?
Right.
All right. How are you doing?
I'm good. I'm good. I thought maybe I'd forego my Dr. Coat and not look like such a, Dr. Cody person today, if that's okay with you.
Totally works for me.
All right. And thanks for me being a little bit late. Mary Agnes is in the background, so don't say anything negative about her. Except
Hi,
it's in my
Mary
ear.
Agnes.
Say whatever
She's
you
in your ear?
want. She's on the couch.
Well,
In my ear. I can't.
we got
hear
a minute to
you.
go,
Mary
Greg.
Agnes can't
Okay,
hear you.
1 minute. Here we go.
Oh,
So we've got Cameron here on the producing the show, and we'll have a little running the blurb for the radio.
How long was the show?
It's an hour long.
1 hour. Okay.
Yeah.
Great. Well, thank
Yes.
you. Video and audio, yes?
Yes.
Yeah.
Okay.
All right. We're going to be live on your page. We'll be live on our Facebook fan page. We'll be live in the group. And it's also live in the actual event itself. And it'll be live on the radio on our station.
Everywhere.
Holy moly.
Yeah.
Like basically the universe.
Yeah. All right. Stand by. Here we go.
Advertisers.
This is ContactTalkRadio.com. Consciousness in action. And you are taking action into your consciousness by tuning into Contact Talk Radio.
And on TuneIn.com, Ping.fm, and UpSnap Mobile.
Contact Talk Radio.
Welcome to What the Health, an independent approach to your health span. Have you noticed how our healthcare system may not have your best interest in mind? Join Dr. Eckel in this fun and sometimes disturbing exploration of the state of healthcare and what it means for you. Now, here's your host, Dr. Eckel.
All right. Welcome back, everyone. I'm Dr. Greg Eckel, and this is What the Health, and I've got a treat for you today. My guest is my esteemed colleague and amazing doctor, Mary Clifton. She is medical doctor, board certified and licensed in internal medicine, and she is practicing out of Manhattan, although she sees people and consults worldwide. She's a recognized expert in the CBD and cannabis fields and is the founder of CBD and Cannabis Info.com, and also a professional facing course, which is the highly respected certification course, the Cannabinoid Protocol. She provides specialized consultation on patients and provider education, telemedicine, and cannabinoids, and has worked with several pharmaceutical, CBD, and cannabis corporations. And we are really lucky to have her on the show. So welcome.
Oh, thank you so much for having me.
You have been very busy out there. I know coming off of, you produced a major online summit.
Yes.
Which has been outstanding. And our topic today, seems to be controversial on the online realms. One of the things I found was I couldn't put cannabis in the title for our topic today. Facebook wouldn't allow me to publish that for some reason.
Yeah. It does limit our ability to get the information out there, which is too bad, because I think that the education is the key to normalization and then eventually regulation and legalization everywhere. But we have to start with just having people know the data that's out there and know how to use the products. And yeah, unfortunately, some of these limitations to advertising and to marketing make it a little harder for people to know about resources like me.
It is exactly why I started this podcast, What the Health. Today's topic, we're talking about cannabis, and we're talking about the endocannabinoid system, which was not even in the textbooks when I went to school from 96 to 2001. We didn't even know about the endocannabinoid system. So I'm really, how exactly, I guess I'm going to start with, how did you get into this field of expertise, or, what is your origin story here?
Well, I've been writing medical cannabis cards as long as it's been possible to write them for my patients in my practice alone. And, sort of listening to them, getting results with appetite issues or with sleep disorders, but not necessarily, for a long time, I thought about diet and nutrition and women's health, menopause, and osteoporosis. And then I had two very significant deaths of my brother and a close friend. And my brother off any cannabinoids, and my close friend with cannabis as her primary mechanism of controlling her symptoms. And the difference between the two deaths was just night and day, a night and day improvement with using cannabis. And then I thought, I'm sure it's just a one up or sort of a coincidence. There's no data. All you ever hear is there's no data.
Mm-hmm.
So I started looking at the data, and that was about 3 years ago. I haven't really gotten back to what I was doing before yet.
Got it. So you just got into the data and you've been like running with it ever since.
Well, I was like, it's terrible that we have such a valuable, powerful tool in our armamentarium that we don't know about, or we feel afraid to talk to our patients about because we just don't have the data. We don't understand. We don't have very simple, easy to understand data points around it. So that's been my job, to create now 100 little 3-minute videos that talk about how cannabinoid formulations work in all kinds of diseases, and also all about the endocannabinoid system and the CB receptors and everything in the body, because it is all very new and innovative. So we need a great educational resource, and that's what I've set out to create.
Oh, I love it. I love it. So let's launch in here. So the endocannabinoid system, for our viewers and watchers and listeners, what are we talking about here?
Well, we really have the people who lived and died, unfortunately, with HIV and cancer in the 80s and 90s, when they were finally able to really come together as a community and say, we need help. We need to get our cannabinoid formulations because they work for us. So, they spoke to the government, they lobbied and said, as a group, you need to figure this out because we need to be able to access these without risk of legal problems. And then scientists started to really look into it. Back in the 1910s, 1920s, and 4,000 years ago, but as recently as the turn of the century, there were all kinds of places where cannabinoid formulations were used. There's a great article I read about a Prince College doctor in London who suggested that if you have a terrible migraine type headache, you should draw the cannabis smoke through water. And then that'll relieve your headache and you'll be able to get back to work. I mean, that was 1920 that was written. I don't know what kind of work the person's doing after they're basically hitting off a bong.
Yes.
But these have been super powerful, really valuable drugs for hundreds, thousands of years for people.
That's awesome. And it really is. I mean, as a Chinese medicine practitioner and herbalist, it's been written about in the oldest medical texts on the planet, the plant, the seed, the root, all of these aspects and the different energetics of those. And then in Oregon, where we've been kind of on that leading edge of legalization, and for both on the pharmacy front and then just patient forward as well. And just getting back recently from California, it's like, wow, this is a different world than I ever imagined growing up in.
Oh, I know. I never would have imagined that I would be able to work in this field or be able to talk and think about these products so scientifically. But when they started to look into the endocannabinoid system, it became clear that these cannabinoid receptors, the CB receptors, really overlie the entire body. They're present in the brain, as anybody who's ever used cannabinoids would be able to tell you. So if you use certain cannabinoids like THC, you'll definitely get a buzz. You'll be aware that you have receptors in your brain. But there's also receptors all throughout the immune system, the CB2 receptors, all throughout your smooth muscle and your regular skeletal muscle. They're on your skin. It's really every organ in the body is impacted. And it's exciting that we have a brand new endocrinologic system that we can impact. I mean, everyone, I'm sure, in your community knows all about cortisol and thyroid, and how if you throw off cortisol, the entire system is wrecked, you know? But the same thing is true of the endocannabinoid system. It touches everything. So regulation and establishing balance and tone to the ECS is so important for your overall health.
This is what I put in the show notes, is this is potentially the missing link for folks for their diagnosis or their health issue or concern, because it is so overlapped. So I'm hoping, I'm wondering, maybe just off the top, we're going to get into research across the way, but like some of your favorite recent findings in the literature, or recent, what you're really passionate or really hot on talking about right now with regards to the endocannabinoid system, on maybe talk to the receptors or some recent research that you found just fascinating.
Well, what I've been really excited about is the reasons why people come to the cannabinoid formulations. You read that 70% of people come because of three reasons: because of either insomnia or anxiety or pain. But in reality, a lot of people come with all of those conditions under their belt, and they get some arthritis pain that makes it difficult for them to sleep, or they have difficulty with anxiety that wakes them up in the middle of the night, and then the lack of sleep triggers their pain. So people are dealing with a lot of issues at once. And the thing that I love about cannabinoid formulations is people are in control of managing their chronic medical conditions. So if they feel fantastic on a Monday because they had a very relaxing weekend and they're ready to get back to work, they don't need to take anything. Or if they're starting to feel a little worn out on Wednesday and arthritis is kicking up, they can take their formulations and get back on their feet and keep moving. They're in control instead of the doctor being in control. And I've had a lot of fun helping people to restore their own health and balance, and be more in charge, more empowered than the way Western medicine usually handles our patients.
Wow. Yeah. So you really are tailoring specific treatments for the individual on their specific dosing.
Oh, absolutely. One of my favorite studies around sleep is a Canadian study of patients with pretty severe PTSD, a group of over 100 patients who were having terrible breakthrough intrusive nightmares and having nightmares up to 5 times a week. And in addition to that, their sleep was very disordered because of the anxiety, and they were only sleeping an average of 5 hours a night. You can just imagine how terrible they felt. And then they got started on cannabinoid formulations, and they were able to add 2 hours on average a night to their sleep, and
Wow.
also reduced their nightmares down to just 1 per week. So it's oftentimes just this management of disrupted sleep from the underlying problem that helps to restore so much balance and relaxation and control back to the person who's been sick. I mean, within this particular study, the researchers concluded that many of these people are on more than one antipsychotic therapy, and it seems reasonable, if they continue to feel this good, that you could stop other medicines that were being used somewhat ineffectively to try to control their conditions. All these people that are dealing with taking a handful of medicines every day could rethink that, I think.
Is there some concern with any interactions? Let's say, you listed the 3 biggies that are bringing people in with insomnia, pain, and what was the third one that you said?
And anxiety.
And anxiety. Oh yeah, of course, anxiety.
Yeah.
Yeah. So for any of the psychotropics for anxiety or lorazepams, there's no interactions, or do people need to? I mean, clearly you got to do this with assistance and professional support. So that disclaimer is there. But in general, what have you found in your practice in helping people
Oh, I think there's opportunity for a lot of people within a number of different conditions like that. I mean, there's a really beautiful Israeli study for people with chronic pain, half of whom were on like maximum dose opioids,
Mm.
and they weren't getting relief, who started into using these formulations, and half of the patients who started the study were able to get off all of their other pain medications and stay on the cannabinoid formulations exclusively. So there's opportunity for, there's a great study out of University of Michigan, go blue, even though I'm a Spartan, my kids are Wolverines. I don't know how I did that, but we'll take it. I mean,
Yeah.
it's a great school.
Same
but,
state.
but they did a great study on fibromyalgia patients, and virtually every one either decreased or stopped their other medications. So there's plenty of room to make these changes, but they should probably be made with the assistance of a cannabinoid specialist and your regular pain doctor, because it's important for everybody to know what everyone is doing. The cannabinoids break down in the liver through cytochrome P450 pathways, the same pathways that break down opioids, actually, the same subset. But we used to think that that might have been why why we needed fewer of them when people were using cannabinoids, because maybe the cannabinoids were sort of blocking the breakdown, and that was extending the life of the opioids in the body. That doesn't appear to be true. It looks as though, even though they use the same pathways, they both move through very speedily, and neither one of them blocks the other one. So you can be pretty comfortable using these formulations that you're not going to get a lot of changes. There is some stuff I've read around Coumadin, warfarin, but I mean, the list of things that impacts warfarin just goes on for the length of my arm, for heaven's sakes.
Yeah.
So anytime you add anything, you have to check the Coumadin level, and it's probably going to be off.
Got it. What about, so different ways of taking these products, right? There's topicals, there's tincture, there's edible, there's vaping. Are there better ways than not, or for different conditions?
I love all the different modes of administration. I used to think it was getting a bit out of hand, and maybe it still is. I met someone who was creating a patch that could respond to the Bluetooth on your phone and excrete more or less as it goes through the day. That seems a little bit fancy for what most people need.
Yeah.
But a lot of people want to start with an edible because it seems very benign to just start with a gummy bear. But in a lot of cases, you know, the onset of action is so unreliable with an edible. You're looking at 60 to 90 minutes before you get to the maximum onset. And if you're dealing with anxiety, for example, and you pop a edible, and then you're going to have, you know, issues with the edible not coming on for a long time and just not getting, you know, you're going to, I mean, if it's 90 minutes later, did it work or not? Who knows?
Yeah. Right.
So most people that have success and are excited and continue to use the products either use vaping or like a personalized vaping device that doesn't have any of the other chemicals found in the prepared vapes, or they'll use a tincture, so that you can get an onset of action of somewhere between 8 to 9 minutes that you've maximized the result. And then you can really see if you're getting a result. And if you're not, you can take another inhalation or take another drop, and you can move through a titration pretty quickly. It might take 2 weeks, you know, but you'll know exactly what you need. Yeah, then you can say, you know what, I'm a 40 milligram twice a day, or actually I need 60 milligrams at bedtime and 20 milligrams in the morning, you know, and you can adjust based on how you feel.
Interesting. So let's talk about anxiety, right? That one seems to be more CBD receptive. Yeah.
I think with anxiety and, you know, the CBDs work really well. And I'm very curious to see exactly where things are going to settle out. I just went to an event here in New York with some Canadian specialists, some Canadian researchers who were saying that the sweet spot on anxiety is 300 milligrams a day in divided doses of 2 or 3 separate servings. That seems really high to me. I mean, most of my anxiety patients are not anywhere near that dose. So that made me wonder, if maybe I'm under treating or exactly what how they're, what their research is showing. So there's a definite great results with anxiety. And when you're using, I think, the cannabinoid formulations, like the more whole flower for anxiety, we have great dosing data around a few particular cannabis plants that are really good for managing anxiety. Some that are stimulating, but not overly stimulating to the point that they bring out panic or paranoia, but that you can have clarity and focus and creativity. It can sort of relax the anxiety. Or in the evening, you can have something that'll chill you out, like a couple of beers, and then put you to bed a few hours later. So some really great products around anxiety that I always love to share with patients.
Oh, that's great. And are those specific, like we hear a lot of stuff coming out about all of the different types of CBD. Those are whole plant extracts that you're using products, or are they like isolated ones, or what's happening there?
Well, it depends on what people's needs are. Some people want to just know if the CBD works. They don't want anything else in their product. They just want some CBD. And in that case, putting it through an extra distillation and getting just the CBD molecules is a great idea. See if it works. But other people really prefer more of a whole plant product, like where the CBD is surrounded by some other trace cannabinoids, and there's some terpenes and phytochemicals in there. It's more of like a more comprehensive product. If that's what you like, then that would be the full or broad spectrum products that are going to give you a little CBG and CBN and CBC, maybe just a tiny trace of THC, and nothing that's going to get you high, but just something that is naturally occurring in some hemp plants.
Got it. Yeah, because it's getting pretty sophisticated at this point with all of the different, the CBN, CBG, and all of those isolates. And just as a Western botanical and Chinese medicine practitioner, I'm more apt to go for the whole plant extract or the whole plant, the way that was.
Me too. I mean, I don't come from a Chinese medical background, but I come from a nutrition background, and I always think you're going to do better eating the whole orange, probably including the peel if you can get it organically, rather than taking a vitamin C tablet. So I'm with you. I think using more of a broad spectrum is good. But if you're, going to be drug tested at work and you're worried about any little bit of THC accessing your system, if you're going to be drug tested at work, you should probably talk to your employer about the CBD too, just to make sure that they're good with it, and then use the CBD isolate. Or somebody, like my mom, who's very scared of these products, but would really like to get some benefit and can't quite get over her safety concerns or her legality concerns, then just do the CBD isolate and you're just at no risk. You can confidently use that and maybe branch out in another year or two.
Speaking to that, like patients' concerns, consumers' concerns with a CBD product, have you seen any side effects or negative outcomes for folks?
Not consistently. I've heard of one or another person who actually has trouble sleeping on the product or has a little ringing in their ears, and those seem to be idiosyncratic, just isolated cases. And what I hear more commonly is that it just didn't work. And it's possible that it just didn't work because you didn't give yourself an adequate time to titrate. I had one fellow tell me, yeah, I tried a squirt. My wife tried a squirt. We gave the dog a squirt. It didn't work. Oh,
One.
okay.
Yeah.
That doesn't seem like a great trial, but I guess you did the best you could.
What do you recommend? What would be an adequate amount of time to, you said about 2 weeks, maybe tops, to titrate it to an effective dose for the individual?
Yeah.
How long should they be on it then to really give it a fair trial?
The best thing you should do is start it and with a reasonable serving size, like 20 milligrams, and set an alarm on your phone for 40 minutes later. and give yourself an understanding of exactly where you're at when you take it. Like on a 1 to 10 scale, is your anxiety an 8 or is it a 4? Like where are you at when you start with the trial? And then when your buzzer bings, you can give yourself another 0 to 10 scale assessment. And then you might find that you didn't get anywhere. And maybe you are more of a 2-dropper full person. So then you can try that then, or you can try it the next time you're ready to try it. If you only try it once or twice, it's going to be hard to know if it doesn't work for you. But giving it 2 weeks where you try a dose every day with that little titration tool, you should be able to know. But in every study, it's somewhere around 17 to 21% of people say that they don't like it. It didn't work. They don't like the feeling. They just aren't going to use it. So it's not for everyone.
Sure.
Definitely not.
On just circling back to the doses for anxiety and those researchers saying about 300 milligrams and a lot, that's a big dose. And it seems like that's true for my patients too. It's lower doses of CBD, whole plant extract, that they're reporting in really good benefit. Even though the research is at higher levels. Like I did a presentation at American Academy of Environmental Medicine 3 years ago now. It was like 600 to 800 milligrams in the research at that point.
Yeah, I mean, and it's hard to say exactly what's going on there. Maybe Canadians are more anxious than we are.
Right.
I'm not sure, but I don't see those super high numbers coming in my practice either. You know, a lot of people do a great job, and it might be because the people that are coming to us are already so savvy on taking great care of themselves. Because, you know, if you surround this CBD molecule with all of the other terpenes that stimulate and balance the endocannabinoid system, like beta caryophyllene, extracts from black pepper, you know, limonene from lemons, pinene from basil. You know, if people are eating a really healthy, nourishing, flavorful diet and they're getting regular exercise, the system is pretty balanced, you know, so it's going to be very receptive to potentially much smaller doses of CBD. And that might be what we're doing, is self-selecting these patients that are just looking for that last little bit of balance and homeostasis to be restored. It's not like, you know, they're just wrecked and we're trying to get just a tiny bit of, you know, of control here. Maybe that's the difference.
Yeah. Perhaps. What about, so on pain versus sleep, there's different ratios. Are you finding different ratios of these products to be beneficial for your patients?
Well, the molecule is the same in every product, but I'm trying to find products that surround the molecule with other healthy products, like all of the terpenes that are already available in our environment or through essential oil companies. You know, these different hemp plants have different terpene profiles, and so one plant may be more stimulatory and focusing, and another plant may be better to help you sleep. And the nature of all of these different products, the companies are way ahead of us. They're not only selecting a hemp plant that's going to grow something that'll be suitable for sleep, but then they're also adding some valerian and skullcap and melatonin to the mix, so you can get this really nice balanced sleep aid. And then they'll have another product for the morning, you know.
Wow.
Yeah.
Oh, that's great.
It's really nice for my patients, you know, because sometimes you just need more than one product. Or when I'm working in, you know, cannabis flower selections, it's unusual for me to have one recommendation for the whole day, you know, because what people need when they're about to go to bed is just going to be utterly different than what they need when they're on their way to work.
Wow. I'm going to take a quick station break. This is What the Health. I'm Dr. Greg Eckel. I've got Dr. Mary Clifton on the show today, and we're talking the endocannabinoid system, cannabinoids, and your health, and possibly the missing link. If you're just tuning in, you can go to naturecuresclinic.com. /podcast, and you can tune in, subscribe, share these with your friends and family, because this is information that you're not getting anywhere else. This one is definitely not coming over the airwaves at you. We've got all kinds of big institutions not wanting information like this to get out onto the airwaves. So I'm really glad to be bringing it to you. And thank you, Dr. Clifton, for coming on the show. Let's talk about I'm going to switch over to something near and dear to me, which is around brain health and neurologic disorders, and wondering what you're seeing in the research with regards to endocannabinoid system and cannabinoids for brain health.
Oh, I'm very excited about all the work around brain health. You know, most of what we're learning about the neurologic system and how the neurologic system responds to cannabinoid formulations is through the research around multiple sclerosis. And a lot of times when you're dealing with any of the brain degeneration syndromes with tremors or Alzheimer's or multiple sclerosis, our patients have two different issues. They want to obviously prevent themselves from having more problems and getting worse, but they also have conditions that need to be treated as a result of the neurologic disorder. They've got muscle spasms, or they have pain from the nerve damage, and it's exciting to have a product that could potentially impact both of those separate issues.
Wow. So both the spasticity and pain in two separate products.
Yeah, the spasticity and pain, you know, the management of the muscle and the painful things all can happen. You know, in the periphery, there's CB receptors on the muscle, but there's also receptors in the, you know, in the spinal cord and in the brain. And chronic pain, when it becomes chronic pain, is sort of the same regardless of where it's coming from. So a lot of the research in cannabinoid formulations has been done on neuropathic pain, this chronic, you know, burning, tingling, searing pain that people get from nerve damage. But there's all kinds of other chronic pain pathways that also have an excellent response to cannabinoid formulations, because it doesn't necessarily matter where the pain is coming from. At some point when you're managing chronic pain, it doesn't matter if it's fibromyalgia or neuropathic pain or pain from your bladder from interstitial cystitis or pain from the abdomen from irritable bowel. It's all chronic pain that your body and your spinal cord and your brain is having to process regularly. So having these neuropathic pain pathways that are persistently affected, you know, with nerve damage, you can get really nice results with cannabinoids working in the central nervous system to reduce that response to the chronic pain.
Got it. And are you finding more better topical or internal for those?
You know, I'm always surprised at how well the topicals work. I have
Yeah.
so many patients that love a balm or an ointment, and it's impossible to ignore. A number of people really like to use those. The other really exciting part about managing chronic neurologic conditions is this possibility of neuroregeneration, of you know, cannabinoid formulations contributing to the growth of new nerve cells. And that looks to be very promising in more than one laboratory. So
Wow.
that's a very exciting potential outcome. But the researchers are saying this is not like you're going to take a squirt of CBD every day and then you're going to be back to normal in a week. This is CBD that you're going to be supporting with diet and exercise and all kinds of other wellness techniques. And then you may be able to get some neuroregeneration. But it could
Wow.
certainly contribute to healthy brain function.
Wow, that's huge. And with regards to, are they showing it like regulating BDNF, or is there, do they know the mechanism of action yet, or they're still under review there?
I don't think that they have it very clear, but you know, there's definite substantial modifications that are made to inflammatory responses in the body. You know, where the body's response to an infection, for example, can be modulated with the use of these products. But the same thing is true in inflammation in the brain. The glial cells, the cells that protect the brain from infection and inflammation, can be impacted after they've had communications with cannabinoid formulations. So
Wow.
you can impact the amount of inflammation in the brain, and surprisingly quickly. There's some PET scans coming out of, Dr. Ruan's work in Houston that are surprisingly profound in how much of a reduction there is in inflammation pretty quickly after starting CBD therapies. You have so many people in your practice, as I have in mine, with hot brains, inflamed brains, and all the way down to the poor little pediatric peanuts who are, dealing with an infection that's left them feeling that's left them with a troubled brain. There's a lot of patients who have the potential to benefit
Mm.
from an impact on neurologic inflammation with these.
Wow, that's huge. And maybe we want to start looking at putting that in our concussion protocols as well, just feeding that system.
That's a good idea. That's a great idea.
Thanks. So with it just hit me when we were talking. It was like,
Yeah.
yeah, actually I hadn't considered that before, but it just makes sense to really, address this system. So on the endocannabinoid system, are there once these receptors get filled, do you have to take a break? Are there ways to, I know there's some discussion around, heavy THC users, building up a tolerance, and then they can kind of come through with a high CBD product to kind of clear their receptors off, right?
Yeah, if you get too much THC, there's a lot of different companies that are creating like these parachute products so that if you get into trouble where you've had too much THC and you're just not coping well with
Mm,
it, you can take the CBD and it'll pop the THC off the receptors and just help you to kind of come down and feel a little better. If there's, oftentimes that happens when people indulge on an edible and they haven't checked the milligram concentration, and then all of a sudden it gotten way too much. These
mhm.
edibles, I think, are sometimes really um, hard to understand exactly how much cannabinoid formulations are in there. So if you're just thinking you'll start out, trying stuff with a brownie or a cookie, I really want to advise you to be so careful with that. So many of these brownies or cookies are like designed to be a bite, being a full dose rather than the whole cookie. And if you have the whole cookie, you'll just be miserable.
Yeah.
But I don't think that there is potential for an upregulation to the CB receptors, and so there may be over time a need to add, higher amounts to each time that you use the products. You could also take a holiday on some of the products and just and go away from them. But the reality is, if we weren't under this weird prohibition and we were trying to live the way we should be living, we'd have cannabinoid exposure all the time because these are just weeds. They'd be growing in the ditch. The animals that we would be farming or catching wild would be nibbling on the herbs, and
Mm,
we'd have a little exposure to it all the time, even if you weren't intentionally, administering. So
wow.
there's probably value to getting some regular exposure, and I would argue that in a lot of cases people are deficient in and have poor tone to their system that probably contributes to everything that they're dealing with.
For sure. Do you know, are there specific things that lead to imbalances on the endocannabinoid system?
Well, I think anytime the endocannabinoid system is there to restore balance and homeostasis. I mean, that's its job. If you take a biopsy, for example, of a sick intestine, you'll find higher levels of CB receptors on that intestinal
Hmm.
wall. Or if you uh, like draw some fluid off of a rheumatoid knee, that fluid will have the naturally occurring endocannabinoids that your body makes. Anandamide and 2-AG will be in higher concentrations in that fluid around the knee. So your body already regulates the endocannabinoid system, but under persistent stress, it's kind of like adrenal fatigue.
Mm,
The body's systems get a bit overwhelmed with ongoing pain and ongoing anxiety. So that's where, supplementing with a phytocannabinoid, from a plant will be really helpful to
mm,
keep the balance and restore the tone.
cool. And with So just through dietarily, or you're talking about really on these products?
Oh, I mean, I think if you're worried about using CBD or THC or any of the other cannabinoids, you could try to go after it with diet, or with essential oils. I mean, the terpenes are
Mm,
basically essential oils. They're just volatile compounds. And the companies that are building out terpenes, like True Terpenes, or though they're all, using they're all using plants. They're not using cannabis plants to extract a small amount of terpene. They're getting their limonene from lemons, just like
mm.
because it's here to extract. But then you can mix it in and get a much clearer, more focused response to the CBD. The CBD molecule itself, like we've said, is the same from bottle to bottle, but it's how much CBD you're getting, but also the terpenes that you're using around it. People say that the CBD starts the engine, but the terpenes actually create the driving
Mm.
experience. They drive the car. So you can, use the CBD in combination with a bunch of other things. Or you can just say, what I really need to do is get clear and focused and alert in the morning. Then there's a group of terpenes that you could get from a number of different companies that would allow you to do that with or without CBD.
Hmm.
Yeah.
Do you know, just out of curiosity, random thought, anybody delivering them intranasally?
Oh, there's some great work being done on like atomizers intranasally, also inhalers for COPD or
Mm.
for people who are smoking and getting a lot of inflammation from smoking. I'm excited too about some work in ophthalmology in eye drops, where
Mm.
people are working on their glaucoma with management with eye drops. There's a whole bunch of ocular benefits to using cannabinoids, as you can imagine, because it's just the big funny thing about cannabinoids is that everybody gets a bloodshot eye, right?
Oh, yes.
Everybody's always like taking their favorite cartoon character and drawing a bunch of bloodshot on the eye and then
Yeah.
trying to use that as their branding, and it's like you just
Yeah.
can't do that.
Yeah.
But I mean,
Geez.
it does redirect a lot of blood flow to the eye, and it also vasodilates the blood vessels
Hmm.
in the eye, and that big rush of healing blood flow is very nourishing to all of the parts of the eye. But of course, it also drops intraocular pressure. So there's some people looking at using it as an eye drop, which
Wow.
is really exciting. I mean, and so innovative and disruptive. And I'm proud of these forward-thinking researchers that can come up with a great new idea.
Yeah, that's really that's impressive, and it's just like the sky's the limit, really. There's all kinds of options for folks to go with these products and innovation, delivery method, and efficacy, right? How do people pick a good company? Or, CBD is everywhere at this point. So do you have some criterion for folks to like make sure that they're getting a good quality product?
Well, I think that the best thing you can do is expect your company to do third-party testing on every batch. So you should be able to flip your box over and scan a QR code and then get third-party testing, not just on the level of CBD and THC in the product, but also insecticides and pesticides, terpene profiles if you're interested.
Mm.
And I would also make sure that they're tested for heavy metals, because hemp plants are very good at concentrating metals from the soil. So you can get into a lower quality product that may have a heavy metal concentration that you're
Mm.
not happy with and you don't want to expose your body to. So keep your eyes peeled for those heavy metals. And then I always love a product that's pretty concentrated, because when you're taking higher amounts to try to control conditions, or you're taking it chronically, I'm not a big fan of a lot of extra oil. So I mean, if you can get it in a half a dropper full as opposed to a dropper full, that's a good idea.
Hmm. for a concentrated product, not having a lot of fillers. That's where you're going with that one.
Right,
Yeah.
right. If it's more concentrated, if you've got, 500 milligrams in a dropper, or you've got, 3,000 milligrams in the bottle, then of course you'll be able to really dial down the amount of oil you're exposing yourself to. So I think concentration matters too. But
Is,
it is hard to figure out. There's a million of these products on the market. A
there
million.
really are. And they're all different doses, right? So there's, sometimes you'll see they list it by amount per bottle, and then having you do the math on, okay, well, what does that mean per dose? Are there higher concentrations? I guess I haven't really looked lately, but I guess when I was looking maybe a year or two ago, it was like 3,000, it was like 3 grams per bottle, 2-ounce
Yeah,
bottle, something like
that's
that.
that's a good dose. That's a nice concentrated product. I keep saying dose, and the FDA doesn't allow us to say dose. We have to say serving size. So I have to scratch that dose I just said.
Oh, all
But
right.
no problem, I'm sure. But the amounts are tricky. I was trying to do a video a few weeks ago, and I got out all the samples that people send me, because I have like a drawer full of this stuff
Yeah.
in my kitchen, and it's so different. There are so many different size bottles, and the droppers are different. So you really do just have to select a good product. Look for a high quality product with very transparent third party testing, preferably concentrated, and then just give it a try.
Great.
Yeah.
What about anything else in the neurologic realm? So we talked about mainly in the MS realm. Have you come across anything around Parkinson's, just out of curiosity?
Oh, I really love all the studies around Parkinson's, because they're just so conflicting. There's some studies that have shown significant improvements in tremor. Probably the best research that I've been able to find around Parkinson's doesn't show a significant improvement in tremor. But it's interesting. If you actually look at the number of times that a Parkinson's patient has a tremor per minute before or after treatment, there's no difference. But the patients in the study are saying that their tremor is better. So there's also, as I'm sure you know, and most of your community knows, the issues around sleep with Parkinson's, where a lot of people who are having trouble sleeping and with Parkinson's especially, have these night terrors once a week or so, these very forceful nightmares where they feel as though they're being chased or they're being yelled at work, and they have these big movements in their sleep, and they've injured their partners. A lot of people have had problems where their bed partners have been injured by them flailing an arm or leg at night. Those night terrors associated with Parkinson's go almost completely away in many cases when people are treating with cannabinoid formulations. So that's
Wow.
super exciting. Again, if we can control sleep and anxiety, we can save the world.
Yeah.
And I think that's true in Parkinson's too. There's more of a sleep and anxiety overlay than we want to admit. So I can't tell if it's working specifically directly on the tremors, or if it's something where we're getting results from working sort of around the tremors, if you will.
Got it. Well, anything to make any differences in that condition or other chronic neurodegeneration is definitely needed, as there's been no breakthroughs in 300 years. So
It's so true. It's so true. And it's even really simple things. I mean, I think sometimes just managing the symptoms is so valuable and estimated in how important it is. Like with ALS, one of the things that we can harness that we get from cannabis that we don't get from a lot of other things is dry mouth. A lot of these people have a terrible time with their secretions. And if your mouth is dry and you're not busy swallowing all the time, you're not aspirating some of that swallow and heading in with frequent pneumonias, so you can keep the mouth and the oral cavity a little drier with cannabinoids and help a person who's sick with a disordered swallow potentially have a better outcome over time. That's
Wow.
something that I just don't even think about. Like, how could we decrease oral secretions and help make somebody do better? But that's a really marvelous thing that cannabis does in this case.
Wow. Yeah, that is on decreasing. Yeah, because you don't really think of that so much as therapeutic, but that would be very beneficial to not get pneumonia. That is for sure.
Yeah, it's one of the things I love about cannabis is that, obviously you'd be just riddled with anxiety if you're an ALS sufferer. And then in addition to that, having the respiratory compromises and the disordered swallow. And then, probably also having the muscle spasms and the trouble sleeping. And I mean, just you can this is like the old antibiotics we used to use that killed everything. You
Yeah.
didn't have to think about what was causing the condition. You just put somebody on Zosyn, and every bacteria in their body is gone.
Yeah.
We probably need to be a little smarter and target it a little better, but when it comes with cannabis, you can get all of these symptoms under control, and you're using one thing.
Yes.
That's pretty neat.
That's awesome and potent. Do you have any case studies that you want to share?
Oh, yeah. I have so many great patients that I've been taking care of recently, just really remarkable people. What I'm really impressed with is all of the innovative people who are thinking about cannabinoids, when none of their neighbors are, or when they're
Mm,
in an area where things are just starting to open up. And a lot of patients I've been talking to for consultations from Oklahoma are in that place right now, because Oklahoma is just opening up. And I just talked to a fellow with pain and insomnia, and we've been working together for a couple of months now. He's getting excellent results.
mm.
But, he said to me, the state of Oklahoma, he said, I've read the 57-page book that Oklahoma put out for cannabinoids, so I'm good to go. I know what I need to know. I thought, I have given out more medicines with crazy side effects and
Yeah.
high risk, and
Mm.
I don't have a 57-page booklet to go with any of them.
Right.
When people are stepping out and actually
Wow.
doing this, it's so impressive. It's
Yeah.
just so impressive to me. But and then I've been taking care of some really amazing young men too, that have been in terrible accidents where they've broken major bones, like big motor vehicle accidents. And so they're young, but then they're in pain and they're trapped in the house, and they're at a weird point in their life to be, to have such a tiny world and to
Yeah.
have so much physical symptoms going wrong. So, with those people, the anxiety is just through the roof, and the pain has been hard to control without opioids, and everyone is so scared to get
Mm.
themselves into an opioid situation.
Got it. And so you'll start patients right simultaneously, like after an injury, and kind of get them ramped up to an effective dose, even though they might be on some muscle relaxants or opioids, but doing that under your guidance. And you consult folks via telemedicine around the globe. Yeah.
Yes, yeah. When I'm consulting in telemedicine, I'm really coaching. I'm not writing a prescription. I'm just having a conversation with you about what your best selections would be, and how frequently you should administer them, and how to administer them. But
Oh, great.
a lot of times you can go on my website and watch a few videos and have all the data you need from that, just to be able to go forward and pick out what you need. I'm going to shoot some video too on my favorite medical products, and make sure that people have really good advice on 40 or 50 great strains, so that if anybody is leaning more toward the cannabis community, they'll have some really good selections to review.
Oh, lovely. And that's on your CBD and cannabisinfo.com, that website?
Yeah, I think I'm going to put them there. We might have to have you click over from there to another site. I just have to see what we're doing there. But they're also going to be in my book. I'm publishing a book with Sterling Publications. I think, Dr. Eckel, you're going to be featured in it, along
Excellent.
with some other brilliant doctors.
Oh, thank you. When's that coming out?
It comes out, like, it's going to be ready for Christmas time.
Great.
for Christmas sales. So September or October, we'll start creating some buzz around it. But that's going to
Awesome.
that'll have all of this information in it
Well,
too.
definitely keep me in the loop there for sure. Yeah.
Absolutely, of course.
That's great. Super excited to help get that word out. I mean, this is medicine, you know, growing up in the 70s and 80s and just thinking about, you know, pot and marijuana. Now we're into cannabis and legalization within a medicinal realm. I mean, really never in my lifetime had I considered like this is what we'd be talking about, right? As professionals in really helping change lives. I mean, we know it's always kind of been there. People used it as folklore and medicines that way, but to really get the research out behind us and legitimate research, like this is worldwide, this is going on around the world, is just so impressive and, you know, really helping increase people's quality of life.
It really is. I mean, we've got great research coming out of Israel. They're looking at all kinds of formulations that are very specific to serious gut conditions, to cancer. We're going to have some really exciting synthetic products coming soon. And then, also, Greg, there's some great population-based data coming out of Italy. Italy offers tinctures to their medical cannabis patients. And of course, the tinctures are in, I know you're not going to believe this, olive oil. they have these really great population-based trials where they're just asking people as they're coming in and out of the dispensary, what are you doing and what's working for you? And we're getting really remarkable, interesting, valuable dosing data from companies like Strainprint and PotBot, where people are putting in the product that they're using and doing that 0 to 10 scale. And then, unfortunately, the data isn't really forward-facing. It's they're working with companies rather than with people. But we can get data where you know they have data on 1.5 million different episodes of administration. So
Wow.
we can what works on anxiety? Well, you know, we have a bunch of people who have tried this or this or this or this, and this seems to be the one that works the best. So there's some great, valuable data coming forward now.
Wow. What other kind of coming down the home stretch here, any big innovations or other things that you're super excited about in this field?
Oh, I'm really excited about the synthetic products coming out of Israel. All of the work that they're doing where they're concentrating CBG or CBN and trying to see which one of these is the most anti-inflammatory or which one is the most cancer fighting. I still am a whole foods girl in my heart, but I also see the value of concentrating nutrition and supplements and otherwise. So I think there's going to be some very valuable products for people who have difficult to control Crohn's disease or inflammatory bowel diseases like that, or cancer, where you can get even better relief from synthetics than from the existing whole flower products.
Wow. So what, in the last 2 minutes, any last words of wisdom for our What the Health viewers or listeners out there?
Well, I have a lot of information on my website, and I'd love for you to go and check it out and see what you need. And then if you review and you can't find what you're looking for, or you have a topic that is burning, you can send me a message in the contact us. All of those messages go directly into my email. So I will respond to them, as quickly as I can. And if there's a trend here that a lot of people have a question that I haven't answered, I'll shoot those videos and make sure that you have what you need. So your input is really important to me for future video production and planning. So I'd love to hear from anyone who could use some help with how to use these products.
Love it. Thank you so much, Dr. Clifton, for coming on What the Health. We are here Tuesdays from 2 to 3 p.m. Pacific Standard Time. Please share this with your loved ones. Get out there, write us a review if you like the content. Give us some 4 or 5-star ratings out there. If it's lower than that, get in touch with me. Yeah, give me a 5-star.
Give 'em a 5.
And I really appreciate you coming on today and sharing those knowledge bombs and your expertise. And everybody listening, please go to her website. It is a wealth of knowledge. She is the expert in North America right now and is doing some amazing work for all of us. So thank you, Dr. Clifton.
Oh, thank you. Thank you, Greg.